Hello world, my name is Dr. Shahan Das. I'm a consultant forensic psychiatrist and I live and work in London. I assess and rehabilitate mentally disordered offenders, or what the tabloids might call the criminally insane. I regularly assess defendants in courts, in prisons and in special secure units that are reserved for the most dangerous and violent criminals. Although I specialise in criminal psychiatry, I've also got expertise in most aspects of mental illness, and this particular podcast is about other non-offending aspects, namely PTSD, post-traumatic stress disorder. This video podcast series explores lots of different mental health topics, and it's for the layperson who's interested in learning a bit more about severe mental illness. So in some episodes, I'm going to analyse how these mental illnesses are related to offending, but not this particular episode. And I'll always share with you some of my insights and just telling you what life is like from the perspective of a psychiatrist. So this episode is quite special. I'm quite excited. I'm interviewing a gentleman called John Clarke, who is an ex-copper, somebody who suffers from post-traumatic stress disorder, and just a generally good all-round bloke. And then afterwards, I'm going to give you some insights about this disorder. It's a two-part interview, so next week's episode will be the second half. Let's get straight into the interview. Sit back and enjoy, and welcome to A Psych for Sore Minds. So today we've got a really special guest, John Clarke. Hello to you.
Good idea.
So John's very kindly agreed to come onto our podcast to talk about his experience with mental health problems and diagnosis of post-traumatic stress disorder, something that I see fairly regularly in my career. So I've interviewed firefighters and people in the Grenfell Tower fire, for example, but never a policeman. So I'm really sort of interested to hear about your life and your experience. My first question would be, John, what is it like to live with post-traumatic stress disorder?
Do you know what? I've had it for about 2 years now, diagnosed the last 2 years, and it's been really tricky. It's probably the best way to describe it, really, because it's to try and live with it is actually a really difficult thing, and it has an awful habit of catching you out when you least expect it.
Yeah. So can you give us an example maybe of recently where you've been going along and having a normalish day and then out of the blue something like triggers you or upsets you?
Do you know what? The most recent one is only a few days ago. For instance, we were in TK Maxx in town doing a bit of shopping, and we came to the knife aisle, and it just set me off on a really bad sequence of sort of thoughts and everything. And it had quite an overwhelming sort of an effect on me for the rest of the day. And it was really strange. So just sort of one is, just been in a shop, seeing some nice, quite a normal thing that I've done. I'm not saying we go into nice shops every time, but, we're in a shop looking around in the kitchen aisle and just seeing it. And it had such an overwhelming effect at the time. And the problem is it's the physical effects as well. So when you're in public, it's quite hard to control. I mean, I used to suffer quite badly with panic attacks. And I've managed to sort of get a grasp of those, but they're quite exhausting as well. It's just. Do you mind describing to us what one feels like? What kind of goes through your head and physically what it feels like? So it's funny because I get really uptight really quickly. I think there's a big part of me that's trying to stop having thoughts. So I become really tense and start sweating. And I used to suffer really bad with palpitations. Actually, is one of the things. And when my chest started really, really beating, it feels like my adrenaline goes on overdrive almost, and I become really sort of sensitive to things going on around me, and so I suffer with one of the other things. I'm sorry if I digress a little bit, but one of the other things I sort of suffer with triggers is noise sounds. So when I'm in a public place, something loud can just trigger me really bad, and it can make me really. I think they call it hypervigilance, where it makes me really sort of worried of my surroundings and what's going on. I don't like being in close proximity, which at the moment, obviously with COVID and that, it works in my favour really, because people don't get into my comfort zone.
Yeah.
It's just being in public becomes really difficult for me. because it becomes really uncomfortable. And, when you're with your family, your wife and your children, and I'm supposed to be the one that's, had the role of a dad out and play. It becomes quite difficult, and it makes me feel quite upset, really, and not embarrassed by it, but it's difficult.
So I have to ask, when you're with, for example, your wife and your kids, and when an incident happens, like when you were at the shop at TK Maxx recently, is it easier to tell them what's going on, or do you feel like you don't need to worry them as well?
I think it's with my kids. We're in a world where we try and be open about everything, and my kids are really good and resilient, to it all, and they've been amazing actually. But I try and protect them from it a little bit, so I try and hold it in and stuff. But my wife has obviously been with me the last couple of years. She really has started to know when I'm not quite right. So I go quiet, and I go quite stiff and upright, and she'll be talking to me and trying to have a conversation, and I just won't be in the room. Is probably the best way of describing it. So she's very aware of then sort of guiding me a little bit, in taking charge of what situation we sort of then move through with the children and that. And she just kind of lets me have my little bit of room and tries to snap me out of it by having a conversation with me and about different things, just to try and distract me from my thoughts, which is quite strange, but they're quite overwhelming. With PTSD for myself, I describe it like a second voice, and it's a really overbearing voice, so it can be really critical of myself quite a lot of the time. It can make the dangers seem a lot worse than they actually are. So I think with my wife, what she tends to do for me now is this sort of distraction techniques, just to try and talk to me, and we go and sit down and have a coffee, and everything just takes that little bit longer, unfortunately, when we go out now. Yeah. It's we were planning to go traveling, and it was kind of a plan to keep me obviously, when we're in these situations, how I was going to deal with them. And I've spoken to my CBT therapist, a cognitive behavioural therapist, at quite a lot of length about dealing with situations. And grounding techniques is one of the things that we sort of spoke about, talking about a place where I can remember and things like that. I apologise if I get a bit, I start to speak quite quickly, but it's where my mind takes me at the moment. No problem. Sort of the last 2 years, I thought, just sort of developed.
So it sounds like having somebody as understanding as your wife makes a big difference, right? Because I imagine if you had to deal with all of that internal turmoil at the time, and you're, for whatever reason, too embarrassed to tell people about it, or not even sure what's going on, then that must make it even tougher to deal with all that and try and keep it a secret. Keeping it a secret, I think, is something that I've learned to deal with those emotions and be quite open about now. But prior to that, I was quite good at being deceitful, and I could hide every emotion I had inside, just keep a straight face, could put a smile on. I spoke about it to someone the other day, and I could enter a room and be myself, put a smile on everything. But actually inside it was actually quite difficult, especially in certain social scenarios. But what that means that I was tending to do, and still do to a certain extent, is I refrain from going out as much as I used to. My social circle really shrunk. Well, it definitely has, because I don't want to be put in those sort of scenarios, and I don't want to have to, because it takes quite a lot to hide my emotions sometimes, because you still get the leaks coming out, with sort of frustrations and things. So I don't want that to happen. So I tend to, with myself, I become really not subdued, but I tend to isolate myself a lot. Okay. And have you found a difference in the way that different people, friends, relatives have accepted it? Has everybody accepted it, or do you get a range of reactions? Absolutely, a range of emotions. It's funny because people my generation, funny enough, are quite accepting of it, but it seems maybe older generations find it quite hard to understand. And I've known people who have, been in their careers and finished a lot longer ago, and they look back at me now and say, well, I've done that. And, so what's the difference? But has anyone said that to you directly, or is it more in the way that, is it more in their sort of tone and facial expression? I was thinking about this, after sort of reviewing some of the things we said we're going to speak about. And one of the things I remember, certainly early on in my career, is
people, when they knew people off with like mental health illness, mainly depression and things, because that's what sort of got fed down the line. It wasn't ever PTSD, it was never mentioned then. But if people were off for periods of time, people would be quite funny about it, because it wasn't a physical injury that people could see or know how to get fixed as such. People were quite cruel about it, I think, certainly in my early career. And I think maybe that was part of the reason why I kept a lot of my emotions in early on and didn't speak about things with my colleagues and certainly my senior colleagues. But as time went on, I think you become, I was in the police for 16 years. And I think as I became more respected, then I became less willing to share because people were, looking up to me because I was on a specialist role. So I didn't want to give off any kind of, I don't want to say weakness because I don't think that's the right word really.
Vulnerability, maybe.
Absolutely, that's a really good description, really. And I think.
So, do you think that I've never worked with the police, but I imagine that the culture of being a policeman must be quite a tough guy kind of image because you have to deal with potentially violent and aggressive people all the time, right? So, I was just wondering, do you think the culture in the police made it even more difficult than people who work in different areas?
It's funny because I don't know if it's a culture would be a kind of an easy way to describe it really, but I don't think it was that. I think it was more of a reluctance to show your peers because you want to be the best person you can be. You want to be the best police officer you can be. You want to be able to go into any situation and show that you can take control. You can be straight. That's all part of being a police officer. So if you start showing off, you've been a little bit fearful going into situations, people start, if you're double crewed with somebody, they want to know where you're at when you're going to deal with a situation. So if you've got a little bit of concern about your colleague, you don't know what their thought process is going to be because, we can go into some pretty difficult situations and you need to be fully in control. So if you have a little bit of doubt about how your colleague's going to control that situation, it can make sort of dealing with things quite difficult.
Yeah.
And I often say about, when you hear about police officers when they snap, when they're on duty and, they do something a little bit out disproportionate. We used to have something called the conflict resolution model and you didn't see it very often, but sometimes you think, well, someone might have been a little bit overbearing. They didn't deal with that very well. But just of late, I've started reflecting on that a little bit. And I think what's interesting is what people tend to forget about the police officers, you're dealing with stuff in such quick succession that you don't really get to deal with a lot of stuff. So I think you take on a lot of anger, you take on a lot of fear, you take on all of these range of emotions that just build up to. And I think we just, sometimes people just break. And I'll be the first person to admit that emotionally, towards the end, I thought for my whole career that I was invincible to everything, and we spoke about when I was with my colleagues, I wanted to take control. I wanted to be seen by my colleagues, certainly the younger ones, that I was able to deal with everything. And I sort of said, take a step back, I'll deal with this, fine, you go and you kind of find them a job to go and do and I'll take it all on because that's the role I wanted, Yeah. And then as my career started going on, obviously I went on to the roads policing side, which was seen as a specialist role in the police. And as time was going on, and certainly we have a Rockland family liaison officer, so with like an accident that turns fatal where someone dies as a result of an accident, I'd be then deployed as a family liaison to go and deal with the family. And the emotional drain of that was really heavy, and I look back at now, and I didn't really realise what I was doing at the time, but I was starting to show signs of these things catching me out. So I was saying to a friend of mine the other day, I was in Sainsbury's just doing some shopping after dealing with an incident the night before. And I was crying and I couldn't control the emotion. And I just couldn't figure out for the life of me why I was so emotional. I was like, I'm so in control of these emotions, but for some reason, I was just fully overwhelmed. And, I dealt with that, got on with it, pull yourself together, and get back on. And then I was back into normal duties and like I said, going through these events so quick. And obviously,
so for our viewers and listeners, they might not know the kind of typical duties that a policeman has to fulfil. So you've already told us about quite an emotionally charged one, having to visit a family after a road traffic accident fatality, which obviously just sounds horrific. Do you mind just talking us through a few other things that you had to do? Maybe kind of what the average police officer has to do on a day-to-day basis, and then also one or two kind of extreme situations that you remember, please. So
yeah, absolutely. Basically, the best way I could describe it, and it's easier for me to kind of explain it, is you have loads of different hats. So at 1 minute you'll be doing the normal, what everybody sees as a police officer, which is normal patrol. So you're driving around. This is for me on the roads police, and you're looking for like road traffic offences and dealing with sort of minor road traffic stuff. Then you can be deployed to dealing with people who are going to shoplifters and things like that. You can then be going to domestics. Domestics are highly charged, really, because you can imagine the emotions that come from those. Yeah. And also one of the roles that I had, we have a system up here, well, most forces do now, where you have like an automatic number plate recognition system and cameras around the county. And what they do is they alert to say that people are moving. And if there's some information about those cars, we would go and intercept those vehicles. So I'd come on duty and we'd be deployed to go and look for, just go on normal duty, but then that would sound off and we would have to then go and intercept those. And I was, because we have obviously London just down the road from us on the A12 corridor, and we talk about county lines. It's obviously quite a big subject. I don't know, you've probably heard about that. So, and people were coming up into Suffolk, so we would be intercepting them, but I'd be intercepting them on my own. And these aren't I wouldn't say I've got to be careful how I say this really, but the nice characters that your petty crimes. These are people with really nasty crimes, with serious assaults, drugs, and just genuinely nasty people. And you're meeting them day to day, and as well as dealing with everyday accidents of people who just drive along, have an accident. So slowing myself down again, I apologise if I'm taking off again.
That's okay. You're doing very well. Keep going.
It's such a varied role, and people always hear about being stopped for speeding and things, but what they don't realise is prior to that you might have been dealing with like a fatal accident and a serious assault, because as certainly on a specialist role nowadays, you don't have the privilege of just being that one area. So like the firearms guys, they don't just get to do their firearms bit all day. They now have to do general policing duties as well. So the workloads for a police officer nowadays have increased massively. And the best example I've given that, we were on obviously in the roads police, and when I first got on it was a designated just traffic. So we were doing anything on the fast roads or anything like that we would deal with. But then over time, we got shrunk down to 2 from a team from 7. And then they put the firearms guys with us. So on paper, it looked like we're a big team still, but obviously all the traffic crimes and everything was still coming just to the designated traffic officers, and the serious accidents we were then going to. So the firearms guys who were supposed to be backing us up weren't always available. So you can imagine the workloads fluctuating. And I mean, I spent, I reckon, the majority of my 9 years of my career policing on my own, and being single crewed, and that takes its toll really, because you never get to offload to anybody.
And were there many times within that 9-year period where you actually felt like your life was in danger? Yeah,
it's funny because you learn to kind of accept it. It's part of you don't join the job to be put in it, but you kind of get a sense of adrenaline is quite like a drug. You kind of enjoy being put in those situations, But there is times where because of your vulnerability being on your own, like I said, I can intercept a car with 3 people up, and you're thinking, actually, I'm in a really big sticky situation here. And it's funny because fear and all those kind of emotions, you do kind of get a grasp of those, and you control them in a different way. So you just put them in but they're there, you still feel them, but you just deal with them in a different way, and you hide them. So yeah, it's I think there's a range of emotions you always felt, really.
I hope this is not too personal a question to ask, but are you able to give us a bit of insight on like some of the scariest situations that you've been in, and specifically ones that might be related to your PTSD? So things that have really impacted you seriously psychiatrically, you think?
I'll talk about, if I stop myself, it's just because I get a bit overwhelmed. one of the last jobs I dealt with was a young lad. He was a teenager, and he got stabbed multiple times and beaten up quite badly, and obviously died as a result. And when I first arrived, that I was the first one. He was still alive, and we didn't know where any of the suspects were. There was a lot of tension with the community, understandably, because they saw this as a result of police failings, and you can imagine I'm going into quite a hostile situation. And one of the things I spoke about with my therapist was actually when I went into that, and some of the things I find hard to deal with now was because the tension was so high, and I'm dealing with something so visually like horrific and emotionally horrific, that at the time I was in control, but actually that's, as it was afterwards, it sparked off a series of events. So my nightmares that I had and things like that are from the feelings that I should have had at the time, but I didn't realise. Does that make sense?
Yeah, so, it does make sense. Absolutely.
You know, with the crowds and things, and I was probably there for, well, it felt like a lifetime, to be fair, but, you know, it was a good few minutes before any of my colleagues sort of arrived to help me trying to take control. And, you know, there was a lot of hostility there. The wounds this lad had were, I mean, they were horrific. And I mean, I've seen, unfortunately, due to the nature of the roads policing side, a lot of nasty sights with injuries, as you can imagine, and bodies being really badly affected. But those injuries, I think the stab wounds and stuff, things like that, were you know, were really, really bad and do stick with me. So much so that, you know, we're talking about triggers and little things. And earlier on, my wife had a joint of pork out the other day, and, you know, to get ready and for cooking for dinner. And seeing the sight of the meat just set me off again. And it just, the triggers to, and it was to that event, to the injuries and everything. It's a really weird link, doesn't it? But how, you know, but seeing that raw meat. And, you know, it's funny because in my career, sights and the gore and that, it doesn't seem to really affect me. For me, it's emotional stuff. Seeing people really affected by that really eats me up, you know. So
it sounds like in that incident, you weren't allowed to react naturally. So the average person that sees a kid that's been stabbed and is dying in front of you will react. You know, obviously it's an atrocious scene, so they're going to be shocked. They're going to look for other people for empathy and support. Sounds like you weren't, because of your professional role, you had to be the kind of neutral, objective person who had to appear to be in control of the situation. Plus you're on your own. Plus you've got all these people that don't particularly want you to be there. It sounds like a nightmare. It sounds like you have to kind of just keep it all together and bottle it up, and eventually it's going to come out in some way.
Exactly. It's you know, it's one of those things. When I was there dealing with it, obviously I've got the lad's life who I'm trying to save, so I'm trying to patch him up as best I can and hold him together, because his wounds were such. You can imagine with stabbing how you need to sort of apply pressure. But I was finding so many, as I was sort of pulling clothes, I was finding more and more wounds on the poor lad. And then I'm thinking, I've got to keep an eye on evidence, because obviously there's crowds there. This has become a crime scene. So I'm having to think about where other people are and what they're doing. I was picking up to my right that there were some weapons and things that I needed to make sure that they weren't moved by people. I was having to try and move people away. I had like a hostile, it sounds horrible saying they were hostile, but they were so emotionally charged that they were hostile, you know, they were quite a threatening presence. So all of that going on. And then I had my radio, which was really, I remember being in my ear, and I had my control room then and colleagues that were en route, and they were sort of saying, where are the offenders gone? Have we got descriptions? So I'm trying to talk to people and say, right, who's, you know, identify people, who were the offenders, what do they look like, what vehicles they get. So I'm trying to relay this in, and I'm so busy with all these little jobs going on that you just ignore your emotions totally, you know, because I think about it now and I think, gosh, I couldn't deal with that, you know. It's amazing how the fear of that is quite, and you know, you're trying to save your lad's life, and I was doing my best for that, but actually even that on its own is really hard to deal with. Absolutely. And then it was kind of, my colleagues are almost shouting on the radio to get more information from me, because they're obviously responding, but then you've got other units coming who with the specialism got your arms, police and that. So if we've got weapons that they then get deployed, and they want to know where the offenders have gone for those to protect your colleagues. So you've got all these responsibilities that all of a sudden I'm the centre point for it.
Yeah.
And that was
so out of interest with the crowds. I know there was some hostility there, but were they willing to help you? Like, were people willing to inform on the assailants?
No, it was quite hard to get information. And there's two sides. You've got the people obviously so emotionally driven through obviously potentially their loved one's friend in such a bad way. Yeah. But you then had the people that just didn't want to interact with the police, and that then becomes really difficult because you're trying to, you say, I need your trust in this situation, but it's really difficult. You can't get it. It felt really hard. And it's trying to get across to everybody in this situation that I want the best for the situation. I want the best for this. I want this lad to survive. I want the best for all the evidence I can gather. I want the best for my colleagues who are coming to their safety. And it's just a really difficult, overwhelming situation, Of
course.
But
and I imagine that in some communities they can't be seen speaking to police as well, right? So even if they wanted to say something to you there and then, they just probably didn't feel safe to do so.
Absolutely, and and I get that. I get that. Everybody has their reasons behind the way they want to interact with each other, and it's sad really because as a police officer for all that time, I always wanted the best for everybody, but. As a police officer, you have to do things. You have to take people's liberty in that away sometimes. And there's always going to be things that people say, especially at the moment. You can imagine with what's gone on around the world, that the trust, trying to gain people's trust, if they've never had an interaction with the police, is a really difficult one. And there's a really good way of describing that, because I can deal with a member of the public who never has any interaction with the police. And then one day I stop them for speeding at a 30 mile an hour, quite a small speed, and if you have a bad interaction, their interpretation of the police is going to be really bad, and it's you're always, and at the moment with the way policing is, trying to resource everything is really difficult. So with burglary, something which if you get burgled is probably the most intrusive thing in your life. If someone's coming into your home where you're secure everything and someone comes into that, to you and understandably is massively effective. But sometimes it'd be a case where the police aren't going to come and see you. And it's like, hang on a minute, why aren't the people? We're going to send the forensic team around to you and maybe we'll get in contact with you. But there's no point sending a police officer to you at this point in time because the offenders are gone and we get the forensics to gain the evidence. Well, we haven't got the resources to send you a police officer. So people are like, hang on a minute, the most intrusive thing you can do is that. And you're not coming to see me. And then I stop them for speeding. So you see where there's that massive, all of a sudden you've got this conflict of what people think of what a police officer's all about.
Yeah. And it sounds like to me it's all about money. So if you, I've been reading about how police budgets have been cut relentlessly over the years. So if you squeeze, then the things that are going to go first and things like police community liaison and the things that are probably seen as not essential in terms of actually solving crimes. So I can see how over time, if you put pressure on the system, then it's just going to increase the animosity and the problems and the frictions of the community.
We used to have your community bobbies, and we still have, because they have something called the Safe Neighbourhood Team. So you still have those, but they're not a police officer that generally that everybody knows in an area now. That's just like in one part of the town. They still cover quite a large area. Then you used to have your school police liaison officers. So if you had a teenager or a child who had potential, I won't say problems, but it was showing signs that he could go down that, they used to be able to get into that, and they would then understand what a police officer was out. They'd build a relationship with that police officer. They'd build a relationship with the community police. So everybody, whereas now they're obviously they've been reduced so much that interaction between people is just gone. And I think, I have to be careful because I've been out, like I say, for 2 years, and I certainly won't want to upset anybody with my personal views, but the budget cuts and everything like that and the reduction of police officers was just going to have such a massive implication. And, with what you've got, you'll always do your best you can, but things are going to suffer. And I think the interaction side, from my point of view, is probably one of the biggest losses,
Yeah.
And it's
also something that's not easy to measure. So it's quite hard to make the argument that that it's kind of decreased or it's suffering over time, I imagine.
Absolutely.
So just changing subjects a little bit, do you think, what kind of support did you have for any police officers to prevent them from having mental health problems? And what do you think we need, or what could be done better?
Okay, so certainly from when I've gone through the process, there was very little support really. And I never like to be really negative about things. I never like to criticise people, but unfortunately there really was very little. You know, they had certain things in place where it's something that the Royal Marines, I think, actually put in place, where they have almost like a debrief over certain incidents, and then they would have someone who would sit down with you and they'd go through a criteria, and depending on what you'd score on that, it's depending on what action might happen. And it's called a trim. I don't know what that means now, but they used to send an email. So if you'd gone to, say I'd gone to a fatal occasion where someone had died, you would then get an email the next day to say you've been identified from a police event that you may have attended this incident. If you would like to get in contact with us, we can then, put you in support. And then what you didn't really get fed back into, you could then have some phone counselling, and now they've put in some different police, one called the Walnut Tree charity, which have then put in some different therapies for the police. But that's only come in as sort of really since I've been in the system really. So prior to that, there was nothing. And I think there was the sad thing, and I look back at some of my colleagues who I've seen some of the things in them that I've done and seen in myself. And I think back and I think, Christ, no one actually probably picked up on when they were really struggling, and it was just kind of accepted. It wasn't spoken as mental health wasn't spoken about. It was just, that's not a valuable excuse. I wouldn't say excuse, but if you had a physical injury, everybody seemed to accept it, So if you had a bad leg or arm, and then you were getting help for it, people could see that. But to explain to someone that you were feeling down or anything, I think would just be a really difficult thing to do. I just couldn't see how you're doing it. So then there was nothing. But I know now they're starting to put in these things into place for support for for the police. Certainly as I've gone on the back of me, really, they've started to put a few, not because of me, but at sort of a similar time, they've put things into place for them. But I don't think enough's been done. I really don't. One of the things I spoke about was this, after attending an incident, it was like sitting down and having a debrief about it, because you think that would happen, with a supervisor. But certainly for myself, on traffic, I didn't see a supervisor for everything, because mine would work in the other side of the county. So we had communication by a radio and we'd speak to each other, but you would never actually sit down with them, or very little. And so that wouldn't give me a chance to say, do you know what, actually, that had quite an overwhelming effect on me. You just got on with it every day. And I think. So what's the solution?
You mentioned a debrief. Do you think that's enough, or do you think there needs to be more resources for police officers?
I think it's really intrusive. I think because I think it comes down to the management really to take on that role. And I know we've spoken about the reduction in numbers and everything, and that then becomes difficult because they've got so many other things they need to be doing. But it's such an important thing to do. So they need to certainly sit down with officers on a regular basis, and touch base with them and start just probing them. Because I've spoken to colleagues recently, and one's a sergeant. He said, the other day he was in office and someone lost his temper, and ended up sort of raising his voice and everything, which obviously we don't do in public, but he did it in an office, And they're all little stress factors that people are giving off that clearly something's on in the background, And it's about making sure that the management is saying to them, hang on a minute, that's out of character. That's not like you. What were you, what's going on there? And then drilling into it and finding out what's going on. But that kind of intrusive nature just doesn't happen, unfortunately.
So it sounds like, as well as a debrief, you need somebody that's sort of proactively looking at the individual officer's mental health, somebody that knows them well, that can tell if something's off, and has a relationship that's kind of close enough that you can approach somebody, right?
Because
sorry.
No, I was just going to say, I was throughout my career, I was talking about being quite deceitful in a way. I was quite happy to take everything on and hide those emotions, but I think had someone sat me down and actually spoke about it, then I think that might have been in the time I would have then said, do you know what, actually, I am, physically struggling with this, or I am having effects of it. I'm not losing sleep as a result of it, and blah, blah, blah. So I think that would have definitely helped.
And just to change subjects a little bit, what was your experience of mentally ill people when you were working in the police force? I imagine you would have seen a few, probably been involved in Section 136s. Is that something you ever involved in? What was your general experience of, first of all, what you saw, but also generally how police officers reacted to the mentally ill, would you say?
We'll take sort of two parts. And see, the first part, we experienced a massive amount of mental health in the police. I always said that most of the people that we deal with in some shape or have a story or a mental health, illness in the background. So we were dealing with people almost on an everyday basis, maybe in a really, minute form or in a really severe form. I mean, for 136, obviously, when people, lost mental capacity and things. So quite often I'd get dispatched to the Orwell Bridge, which is a local bridge to me, and was a spot that's quite regular for people to go and try and attempt to end their life. And I'd be dispatched to those kind of incidents all the time. And I say all the time, it was quite a regular basis, And we were often taking people off the bridge and 136 and then using our powers to detain, to take them to a place of safety, and which would be the local mental hospital that I ended up in, and by one of my colleagues. And, you would do it quite a lot, but there was always this kind of, you pick someone up on the street with mental health, you'd section them, and then right now it's now the NHS's responsibility now to take that on. And there was always that kind of point in the middle where you were kind of like waiting around to almost try and pass people, because I got my sergeant going, John, you need to get back out on duty here. You got the NHS going, hang on, we've got nobody here to come down off the ward to look after this man. And you'd be sitting there going, hang on a minute, well, who's this, whose job is this? And you kind of felt sorry for the person because they're in their worst point of their life potentially. And you're almost...
the reason I'm smiling is because it's kind of bringing back memories for me, because I've been in that exact situation. So when I was a more junior doctor at A&E, when I did liaison psychiatry, we'd have people that would be brought in by the police. And I not always, but I definitely remember a tension of the police wanting to go, which is understandable, because if you don't, if you're busy, especially on a Friday or Saturday night, you don't want to have three officers just standing around A&E for hours waiting for the psychiatrist to finish with the other patients. But at the same time, the nurses wanted the police to stay, because they don't have the physical capabilities of restraining, potentially a big muscly man who doesn't want to be there. He's paranoid or psychotic. So I hadn't thought about that for a while, but it's bringing back memories.
Yeah, it's always good. But I think the irony is that I ended up being one of those people that, I tried to end my life, but I got intercepted by one of my colleagues on my team, and I got sectioned and taken into the mental health. But the other side of the fence, it was really weird to change roles from being there to look after, to being the person that was actually in a really bad place. And it makes me think about how many people I've taken in, and, how I like to think that I dealt with them in a way that was quite empathetic, to their needs, really, rather than being, you can become really, I don't want to say cold as a police officer, but because you deal with it so regularly, actually, it just becomes the norm. Yeah. Right, I'm looking after you, let's take you to the hospital, blah, blah, blah. Right, pass you on to the NHS, it's kind of, you almost lose sight of what that is, because as soon as you pass them over, I'm not saying you forget them, but that's it, you've done your job now. You lose that kind of interaction almost. It's strange. Yeah. But, so I ended up going through it myself. So it's, yeah.
So I thought I would educate you all a bit on post-traumatic stress disorder. I'm going to teach you about the individual symptoms and then briefly mention a couple of cases of patients that I've seen myself. So post-traumatic stress disorder is something that I see relatively commonly in my criminal practice, but not for my criminal cases, because PTSD rarely actually directly leads to offending. I've seen probably maybe 2 or 3 cases in my career where it's led to offending. So specifically, if somebody with PTSD is reminded of an incident that's similar to their original trauma that they suffered, then this can make them extremely agitated and angry, and it can cause them to lash out, sometimes with violence. However, I see it far more commonly in my civil court case expert witness work. For example, I've assessed cases of people who've been the victim of the Grenfell Tower fire. And I've also assessed people in the army who've seen some horrific sights, as I'm sure you can imagine. Another area I've done is previous sexual abuse cases where people have like flashbacks and memories of being abused. So the first logical question is, what is PTSD? So when people have an overwhelming, life-threatening or a traumatic, frightening experience, this can result in a chronic psychiatric disorder. So typically, as well as the cases I've mentioned, it might be something like a very serious car crash, being kidnapped, being stabbed, a very serious assault, or being sexually assaulted or raped. In John Clarke's case, it was obviously what he saw in his time as a police officer, specifically that young boy with multiple stab wounds who died in his arms. And as I mentioned before, soldiers or firemen, another type of job that typically might get PTSD. The majority of people who have these experiences do get over them without any long-term psychiatric issues. When people do get PTSD, symptoms usually start either immediately or within at least the first 6 months of the event. It's unusual, but it's not impossible for them to happen a lot further down the line. So I think it's important to differentiate this PTSD, a psychiatric illness, from usual like grief, depression, anxiety, guilt, anger, any of these feelings that can come after traumatic experiences, which are understandable emotional reactions and are not mental illness. They're not pathognomic. They do not deserve a separate psychiatric diagnosis. In terms of the individual symptoms of PTSD, they're usually grouped into 3 clusters. These are the core symptoms that need to be there for a valid diagnosis. The first one is reliving the experience of the trauma. So that's usually in the form of like flashbacks or nightmares. Flashbacks are not the same of just intrusive memories of the incident. Flashbacks are more than that. So it's actually like reliving and being transported back in time as if you were just going through the whole trauma again. So typically you might feel the emotions such as fear or panic, and you might smell the smells and hear the sounds of the actual incident. For example, if you were in a car crash, you might physically feel the sensation of being involved as opposed to just remembering it. Or if you were a victim of rape, then you can actually smell the smell of the attacker. And sometimes there might be triggers that remind you of it. So to take the above example, if you're a victim of rape, similar aftershaves of the attacker might trigger these flashbacks. Another core symptom is avoidance of these triggers. So for example, for the cases that I've seen for Grenfell Tower fire victims, some of them turn over the channel when the Grenfell Tower is on the TV, on the news, or they avoid the smell of smoke or avoid flames, such as actually avoiding going to a barbecue. And there's often also an emotional numbness. And the last cluster of symptoms is hypervigilance, which is something John mentioned earlier in the interview, which is basically a state of being kind of on alert all the time, being easily anxious and jumpy with triggers such as noises and just being constantly on edge. There are other symptoms of PTSD that are common and are non-specific. So things like feeling panicky, depression, headaches, drinking alcohol, those are all associated behaviours. As an estimate, around 1 in 3 people who've experienced trauma in their lives, that kind of severe trauma, will develop this disorder. So most people won't. Some people might have what we psychiatrists call an acute stress reaction, which is like a shortened temporary version of PTSD, which typically lasts a few weeks immediately after a traumatic event. But that's different. It's not a chronic, lifelong disorder like PTSD is. What I think is interesting is that I've also seen a few cases of people who claim to have PTSD when I actually think it's not an appropriate diagnosis. Sometimes it's actually the solicitors that are claiming this because it's a civil court case and they're angling to get some sort of compensation, which of course the solicitors get a tiny cut of. Cash rules everything around me cream. An example of this is where I recently assessed a middle-aged woman who was incorrectly detained by immigration services for a couple of months. So this woman and a solicitor were claiming that she developed post-traumatic stress disorder just from being detained. And whereas I think that the detention certainly contributed to low mood and frustration and probably a diagnosis of mild depression, I did not think it was compatible with a diagnosis of post-traumatic stress disorder. This particular woman grew up in war-torn Serbia and she saw horrific things. She saw bombs, people being killed, people being blown up, limbs being severed. So she could feasibly have developed PTSD from those previous experiences. I mean, I don't think she did in this case because she never had any reported flashbacks of these incidents. But of course, if she did, then she wouldn't get any compensation in her civil case against the Home Office. But I thought that she didn't get PTSD from being detained in an immigration centre, and I'll tell you why. Before I can answer that, we have to look at the ICD-10 definition of post-traumatic stress disorder. So as many of you probably know, ICD-10 is the formal classification system for psychiatric disorders, which helps us kind of match the symptoms to the disorders, basically to make sure there's some sort of standardization and some sort of consistency, so rogue psychiatrists are not just making up diagnoses. ICD-10 is the most common one used in the UK, and you might have heard of DSM, which is the most common used across the water in the States, although in reality both countries kind of use both interchangeably. So ICD-10 says, as part of its definition for PTSD, that it has to be caused by, and I quote, a stressful event or situation of an exceptionally threatening or catastrophic nature which is likely to cause pervasive distress in almost anyone. So I want you to think carefully about those words, because in my report I opined that being detained for 2 months would, although undoubtedly have been distressing and upsetting for this lady, however, despite this, in my opinion, it would not constitute a stressful event or situation of an exceptionally threatening or catastrophic nature, which, and this is the important part, is likely to cause pervasive distress in almost anyone. And the reason I could say this quite confidently is because I've carried out about 50 assessments in immigration removal centres and several hundred assessments of people who've been detained in prison. I managed to rack up those kind of numbers because I worked for 2 years as a senior prison psychiatrist in a female prison, carrying out several clinics per week. And the vast majority of these patients did not have PTSD. And the ones that did, without exception, this was all related to traumatic incidents which they had faced before coming to detention, not because of detention. There was one exception, actually, which was a man who was severely assaulted in prison, led to life-changing injuries. He was scarred with boiling water after he didn't pay off a drug debt. But that was not just being detained, it was obviously what he went through. And what I said in my report is that I've not heard or seen one single case where a patient has developed PTSD from the act of being detained herself. Finally, in terms of treatment for PTSD, this is usually in the form of trauma-focused psychotherapy, where the sufferer has talked specifically about what happened to help kind of process the trauma, as opposed to other forms of therapy, CBT, for example, which you might have heard of, which tend to delve more into the client's individual backgrounds. And so you usually have about 10 weekly sessions for roughly about 10 weeks. Another common form of treatment is group therapy. So people go to groups and meet up who have been through similar traumas, such as victims of sexual abuse. Another interesting and unusual treatment is eye movement desensitization and reprocessing, EMDR. So this therapy involves talking about the traumatic experience while carrying out these like specific eye movements, such as watching a light go from side to side. And the rationale behind this is that it's supposed to access certain parts of the brain, which makes it easier to absorb and process the trauma. Some psychiatrists might prescribe antidepressants, especially a specific brand, or not brand, but a specific type of antidepressant called SSRIs, selective serotonin reuptake inhibitors. Prozac, also known as fluoxetine, is probably the best known version of one of these medications. And medications might help reduce some of the symptoms, though, like all medications, there's the risk of side effects, obviously. And in terms of other non-medical tactics that might help recovery, that would include just things that generally improve your mental health. So spending time with friends, getting a job, having activities, basically distracting yourself, doing exercise, and learning relaxation techniques. So I'd just like to reiterate some exciting news, which is that this podcast and myself will be taking part in CrimeCon UK next year. So that'll be on the 12th and the 13th of June in London. I'm sure you can find it on the internet. This is a huge convention for true crime fans with a whole host of celebrities and professionals. It's a massive deal in America, and now it's moving over to the UK. So you need to get involved. Go cop your tickets at crimecon.co.uk and use the code PSYCH to get 10% off. So next week's podcast is going to be a continuation of the interview with John Clarke, and believe it or not, it's going to get even more personal than it already has. He's going to talk about the incident when he was brought in by police who were his own colleagues and had to go through the whole process of being sectioned and spending time in a psychiatric hospital, and how it affected him, how he felt about the whole thing. And as always, I'm open to suggestions. So if you're listening to this, or if you're watching and you have any particular ideas, anything you want me to dissect from the perspective of a psychiatrist, which is my USP, to inform you or other people, then hit me up. I'm all ears. And please subscribe to our YouTube channel, follow us on Instagram, like our Facebook page, submit an episode idea or any questions to our email, which is psychforsoreminds@gmail.com, and use hashtag #PsychSore if you want to reference us. I'd really love to get our numbers up, so please tell your favourite people about a Psych for Sore Minds. Spread the love, people. Okay, until next time, stay euthymic, homies.